Good afternoon and welcome to the Greater Boston Chambers event, Looking Forward, Is It Too Soon to Talk About Post-Pandemic Life? I'm Jim Roney, President and CEO of the Greater Boston Chamber of Commerce. At the Chamber, we feature prominent speakers and convene our community around topics that are critical to our members. Today is no different. As we consider our future, the question of post-pandemic life is talked about more and more. What will post-pandemic life look like? How will I know that we're moving closer to post-pandemic life? I know we all feel so fortunate to live in a region that is truly the global leader in life sciences and medical care. So we decided to ask these questions and others to the CEOs of some of the world's most renowned hospitals. Trying to understand the future is difficult in normal times, but contemplating how our lives will look and feel in a post-pandemic world is especially challenging. We're joined by over 700 people from across the country listening to this conversation, so we know this topic's on everyone's mind. Before we get started with our panel of leading experts, a few housekeeping notes. Please note that today's webinar is being recorded and will be shared on the Chamber's YouTube page, and I encourage you to utilize the chat and Q&A function during today's conversation. Now I'm pleased to introduce our panelists. First, we have Dr. Kevin Churchwell. Dr. Churchwell is the President and Chief Executive Officer of Boston Children's Hospital, the #1 ranked children's hospital in the United States for 8 consecutive years. Dr. Churchwell is providing leadership and vision to improve the health of children through their research and innovation, medical education, and community engagement. Dr. Churchwell is also a professor of pediatric anesthesia at the Harvard Medical School, and we're thankful that he serves on the Chamber's Executive Committee. Next, we have Dr. Ann Klebanski. Dr. Klebanski is the President and CEO of Mass General Brigham, a Boston-based integrated healthcare system. As the largest private employer in Massachusetts, the MGB nonprofit healthcare system is a national leader in medical research and teaching. Dr. Klebanski is also a member of the Chamber's Executive Committee, serving as our Vice Chair. Finally, we have Dr. Kevin Tabb. Dr. Tabb is the President and CEO of Beth Israel Lahey Health and is an ex officio member of its Board of Trustees. Dr. Tabb is responsible for leading a pioneering integrated healthcare system offering a full continuum of healthcare services. And I'm pleased to be your moderator for this important discussion. So let's get started. Welcome to you all and thanks for being with us. Today, I'd like to start off the conversation by just setting the stage. So Dr. Klebanski, where are we right now with COVID? What's the data showing?
So I'd say we're definitely in a much better situation than we were a few months ago. And, you know, we have to look at data over time, and we have to look at how we're doing really over the course of over 2 years now. So where we are right now is the number of infected people is going down. The hospitalization of patients who are coming in with COVID is going down. So by many, many indicators right now, we're in a much better place than we were during the peak of this past surge. I'll tell you just for MGB, we're at I'd say 40% of where we were at the peak of this particular surge, and it's going down very, very dramatically. So I'd say all the signs are going in the right direction for us and for other healthcare systems, and certainly for the state.
So just, Kevin, go ahead, please.
I would just amplify that and say that I think we're all feeling cautiously optimistic. The numbers are certainly down, as Dr. Klebanski described, for all of us in the state. But I would also make the point that the pressures on our caregivers, on the staff, on our system as a whole really remain. And, you know, the sharp rise that we saw is now accompanied by a pretty sharp descent. Mm-hmm. But the surge is really receding more slowly than any of us would like, particularly given the fact that our caregivers and staff have given everything of themselves over the past few years.
Just a follow up on the data question before we move on. Home tests are now available. People take them. Sometimes there's no symptoms or mild symptoms. So How much is not in the data that you see because of mild symptoms and home tests that people don't report? What's your feeling about that? Dr. Churchwell, any thoughts on that?
That's a great question. Given the ubiquitousness of the testing and the opportunity, it could be probably more than half of what actually is happening and what we're seeing at this point. And in some respects, we've gotten to the point of how much does that matter? The number of individuals that are infected, the trends that we're seeing has been so significant that I think we're able to make some pretty good assumptions and some analysis based upon what we actually are getting testing around. But I think it's probably more, probably half or more in terms of what's out there.
Yeah,
I would definitely agree with what Kevin's saying. And the only other thing just to mention is it is important, Jim, to focus on the data, as you've said. We just have to be careful not to make too many far-reaching assumptions based on where we are in any point in time. So the data is what it is. We do, though, focus as hospital systems on the number of patients who are hospitalized. I just want to emphasize that in terms of thinking about healthcare and in terms of who can be accommodated at our hospitals in this state. That number is very, very critical, and it brings together the other elements that have been talked about in terms of the workforce demands, the shortages, and the stress. So we do track that one very, very carefully.
Yeah, I wanted to follow up, maybe Dr. Tabb, on what has become an interesting leading indicator, which is the levels of coronavirus in wastewater. That seems to be sort of ahead of the curve. And how important is that? Do you look at it? And as we go forward, will public health officials be looking at that as sort of that canary in the coal mine?
Absolutely. I think it's one of a number of indicators that we look at, and it's turned out to be an excellent leading indicator. So it does give us a sense of what is coming before we actually see the number of tests turn positive, and then consequently the number of hospitalizations turn positive. These are things that don't overlap completely, though. And as Dr. Klebanski pointed out, what we see is even when the numbers drop, the wastewater drops, the number of positive tests drop, the lagging that are the number of, is the drop in number of hospitalizations, because people are very sick. It takes time for them to finish with the illness and come out of the hospitals.
Yeah, it's a great point. And Dr. Churchwell, I wanted to ask if you could take us inside the hospitals a little bit. You may be pivoting off of Dr. Tabb and Dr. Klebanski in terms of the stress, the capacity issues, and maybe a little bit of conversation that I know is in the public domain about your ability to address other medical care while this pandemic is going on.
Oh, great. Thanks for those questions, Jim. I just wanted to add from a pediatric standpoint that we are also seeing this drop from the surge. This Omicron variant, this surge from Omicron was different from what we've seen in the past 2 years in pediatrics, and that it truly affected the number of children admitted with COVID. And that usually we were seeing numbers in less than 10, certainly less than 20. And we were seeing numbers close to 50 or more this time around. But that has certainly dropped dramatically also. Mm-hmm. The issues around the stress are really extremely important. I think they will continue to evolve over the past 2 years of this pandemic. I don't think that we have ever encountered something like this in healthcare. The stress on the continued stress. We certainly see stress, certainly in our workforce and certainly in pockets of what happens in a hospital in terms of number of patients, the acuity of the patients, the mortality and morbidity associated with those patients. But across the hospital wide, I don't think we've ever seen anything like this. And with that has been the response. And I think the response has been just spectacular from those that work in healthcare. It's just an honor actually to work in healthcare, to be part and help those that are really leading the effort. But I think it's going to have some repercussions. And we're seeing that in terms of those making the decision, should they stay in healthcare? What's their future? Why am I here? How am I being supported? What's my next evolution? And those are issues that are right at the forefront for us in terms of listening to our staff, understanding what those issues are and working to address them. So I think that's going to be one of our major challenges moving forward.
You know, Jim, one of the things that we often hear about is it's called the Great Resignation, so that in many different sectors of the world beyond healthcare, we're hearing about immense upheaval in hiring, in training, in people making different career choices. So, you know, I would say that we see that so front and center in healthcare all the time. So being able to maintain that staff, that critical staff, is just so important for the health of everyone. It is also a change from the beginning of the pandemic, where there was this incredible exhilaration in everyone coming together with this single-minded purpose of tackling this new disease that no one knew about. There were no vaccines then. There were no treatments then. No one knew even what the diagnosis could be. And that was an incredible period of time. And that incredible period of time continues. And I think, as Dr. Churchwell mentions, the enthusiasm, the dedication, the commitment, that's all there. Because so much of masking, vaccines has been so politicized, that so many of our workforce are now at the receiving end of being viewed as the mask police. So a lot of that incredible appreciation for our healthcare workers, and we feel this and see this every day, it's not as robust as it was in the beginning. And that's very, very hard for a very exhausted workforce. The second point I'll just make, because you alluded to this in your question as well, is in addition to the COVID patients, there are all the non-COVID patients who have had delayed care for a long period of time. So we're in a bit of a vicious cycle here. So in the beginning, we had to free up capacity. Capacity is always a challenge at our hospitals. We had to free up capacity to take care of so many patients with COVID. We got better at treatment, at managing, at extending or developing new capacity as best we could. But yet so many patients have now delayed care, and they're coming in with delayed care. So they're sicker, they stay longer. And even during this last wave, we've had to again delay care. So, you know, we're in a bit of a vicious cycle here in terms of the kind of care that we're all able to deliver, that we've taken such pride in for so many years.
Yeah. Anyway, I think that one of the biggest problems that we're seeing at the moment is a real disconnect between the feeling of the general public, understandable, that people are, quote unquote, done with this, over it, ready to move on. And completely understandable. I think many of us personally feel the same way. But the virus is not done with us, and it's certainly not done with the work that we need to do in the hospitals. And so that disconnect is really, plus the politicization of the response to the virus, has made it very, very difficult for our caregivers.
Yeah. Let me just follow up on that, because you're right. The Globe recently reported on the Monmouth poll that said that 70% of Americans believe it's time to accept the virus as a part of life, and the numbers were different by political affiliation. So your point, Dr. Tabb, about this sort of political view of it versus a medical view of it. But, you know, what does that mean? I mean, when people say learn to live with it, I mean, what does that mean to you? I know they want you all to just say it's, you know, you can go about your daily life. What does learn to live with it look like?
Well, I'll just throw in that, and maybe I don't want to be controversial, but, you know, sometimes I am, in that I'm not ready to learn to live with it. This is a virus that is extremely lethal compared to all the other issues, many of the issues that we deal with every day. And that's been a driver. Over close to 900,000 people have died from this virus over a 2-year period. And so I do not accept the fact that we learn to live with it. This is something that we have to continue to be straightforward with and actively engaged to make sure that every patient that we are in contact with, that we have the opportunity to take care of, has the opportunity for a life to live, to have the best outcome possible. And so I'm just not there and learning to live with it yet. I'll just give you that, Jim.
All right. Dr. Tab?
Yeah, I mean, I absolutely agree with Dr. Churchwell that if learn to live with it means we should accept the death and the suffering that has occurred and just sort of say there's nothing that we can do about it, then I would reject the phrase learn to live with it. But if learn to live with it means that we are now understanding that this virus will be with us in some way, shape, or form in perpetuity, then I actually agree with the statement. It is true. I think it is. We understand at this point that the virus will not go away. The virus will be with us in different ways and shapes and will affect us differently over time. And we as a society and we as a healthcare system do in fact need to learn to adapt to the different phases that we're going to see with this virus. I think that we're starting to see that shift already. And I do think that we will relatively soon be back at a point where people can travel, people can eat out in a restaurant, and people can feel good about it. But what I hope that doesn't happen is that we then sort of forget about all of the things we need to do to make sure that we stay safe, and as importantly, keep others safe who are most vulnerable in our society.
I also think we have to get around the mythology, which is what people want. When will life get back to the way it was before? That's a mythology, and that's the concept that needs to change. Because during this pandemic, we've learned a lot about viruses. Many of these things have been known by some for a very long time. But we've also learned that fundamentally there are changes in healthcare and healthcare delivery that have to occur. We've learned that. It's highlighted those things. But we also have to be prepared for the fact, several facts. One is to understand that this virus is not going away. That point has been made. Beyond our vision, there's a war going on with mutations. There's always something going on with variants. So we don't see this. It's invisible to us, but we don't know when the next variant will come. We don't know what it's going to look like. We have to be prepared for it. And the second thing, which I know, we all appreciate in the medical profession, is we've now learned what it means to have a pandemic. We have to prepare ourselves as a country, as a world, as healthcare providers for what may be a different pandemic. So fundamentally, the concept of let's just get a date where we can go back to where we were pre-pandemic, that doesn't really exist for me. We have to really shift in how we think. What's the new reality and what is that going to look like for everybody?
Let's talk a little bit about mandates in terms of masks and vaccines. And I think people are both frustrated, but also sometimes confused. And we were talking before we went on about just this morning, the Massachusetts governor dropping the mask mandate for schools, and the New York governor sort of reaffirming the mask mandates for schools. And people see that and they get confused about sort of what's going on, along with other, political and or public health official announcements about mandates and vaccines. How do you think about this? And, I said earlier that elected officials are fond of saying that, they're just following the data and the science, but they don't exactly tell us what that means. What about these public mandates as it relates to masks and vaccines? And I think people think about that in terms of this notion, Dr. Klebanski, that you mentioned of getting back to normal so that they don't have to do these things.
Jim, I think that the decisions that are being made in a thoughtful way. They're being made based upon what is being presented to us now. And you go to what the data shows, but the data is just not seen in isolation, right? It's seen based upon what we know previously has happened and what we assume or are predicting is going to happen in the future. And also, its mask effect on the care of for example, the care of our kids, or the education of our kids, or the mental health and the behavioral health of our kids. And all of those go into the mix in terms of this decision making. But part of that is to also be flexible, to understand what we decide now is what we will continue to examine moving forward, based upon, as Ann talked about, a moment in time. And, the hardest part of this pandemic is the inability to predict and to assume, and to be able to flex on the fly and react on the fly in terms of what's happening next. And so I think that's part of the decision making that you will see moving forward as we move forward, going forward from that standpoint. And that's probably the best way to do this moving forward.
I think a couple of important points to remember here. First of all, the data change over time.
Yeah.
And so it can both be true that at one point in time, it makes absolute sense based on the best data that we have to have mandates around masks and vaccines and other things. And at another point in time, as the virus changes, as the situation changes, that we change our restrictions. Both of those things can be true. The second thing I think that's important to understand is that this epidemic is not distributed in a uniform fashion across the country. And so we see pockets and waves at different points in times, in different ways, in different points in the places in the country. So you can have in one state a real need for a mask mandate at a certain point in time while another doesn't, and then that changes. The last point I'd make is you asked about different states and different governors. It's hard for me to speak to other states. What I know is that in this state, the governor and the administration work incredibly closely with all of us as healthcare system leaders, and the decisions that are made really are made based on the best information that we collectively have. And I think we're very fortunate to live in a state where that is true.
Jim, you have to realize that at the peak of the pandemic, we were on a call every day with the governor, with the secretary, with so many others. And although we're not on the phone every day in that group, this went on for a very long time, and small groups meet continuously. So it's a really important point to emphasize. The second thing to remember, and I just want to talk a minute more about Dr. Tabb's point about different states look different. Also important to remember that even within our own state, things are different. So depending on where you are you in Boston? Are you in Western Mass? Where are you? That may look different depending on masking, depending on capacity of the hospitals. All of these things really play into this. And then the third thing to emphasize is, and this is very hard for people, it's just very hard. You have a continuing series of new information or new data which may change announcements. That's confusing to people. They say, well, somebody said this a month ago, why is it different? So that rapid cycling is hard for people, and it's coupled with misinformation, which is rampant everywhere, whether it's on various media, whether it's on social media, no matter where it is. So you have a lot of these things all hitting people at the same time. So it is hard to get the right message across without confusing people. We all work very hard at it. I know we do that, but that is a challenge collectively.
Dr. Klebanski, you anticipated my next question about information, and we have a pandemic that's become politically charged in a digital world in which information is flowing all over the place, a lot of misinformation. I mean, tell people where to look to get good information. Where should they go? Where should people look for good information in the moment? Dr. Tabb, you want to take a stab at that? You're on mute.
Sorry, I say, sure, a couple of things. I think, first of all, we need to look to a real trusted sources of information. There is a lot of misinformation out there, particularly on social media. And we've talked about the politicization of what's happening. Science itself is not political. And we need to be driven by scientific facts, not by emotion. There is plenty of good information out there from trusted sources, from healthcare systems, from people who understand infectious disease, from people who understand public health. And again, in this state, really that's in concert with the administration, who really work hard at putting out information that we collectively have agreed upon.
Okay.
I think part of the challenge too is that a trusted source and an authoritative source may not be the same thing. And that is, again, just to amplify a little bit about this point, sometimes people will trust information from a source, but it may not be an authoritative source. So again, we all look to healthcare providers. We look to what we would consider to be authoritative sources, physicians, whatever that looks like for a healthcare system. We are very, very strongly, I'd say, supportive in pushing that information out. But, for the average person who may not have a relationship with a physician, they may not be seeing someone very often, that trusted source of information may actually be what they're looking at on social media. So that's just, again, another challenge in getting the right information out. Is the right information the scientifically driven information, the clinically accurate information there? Absolutely. But getting that out broadly can be challenging.
I wouldn't underestimate the challenge there. I recently saw a poll, a YouGov CNN poll, not about healthcare, but about the fact that a sixth of the country is not sure that the earth is round. And so, a lot of this comes from rampant misinformation in social media. It's not solely in healthcare that we're seeing this problem.
Yes.
Yeah, Kevin, that's exactly right. I'm doing my research on if the earth is round, and I keep getting different sources there. But just to emphasize what Ann and Kevin have said, that our ability to communicate is the challenge. It is just the key challenge. Our ability to communicate and be seen as that trusted source of information, of data, is our challenge. And it's not what you say, but sometimes how many times you say it. It's what environment you say it in. Who are you talking to? Which groups are you actually pulling in to really communicate to? And who are you using to communicate? For pediatrics, are we really working with our primary care pediatricians as the example? Because in our environment, that's the trusted source. They are the trusted source for our families. And working with them to get them the right communication, the right data, the right information is really key for us to get our message across.
Dr. Churchwell, I want to stay with you because you're quite popular in the chat and Q&A. This is a business event, but there's a lot of parents too, and they want to know your thoughts about the school mask mandate and Governor Baker's announcement today that he will lift the mask mandate at the end of February in schools.
Right, and I think that's all about, as you can see, the timing. The ability to give a defined date in the future, I think, is important. I think that as the governor and the state and our healthcare providers working with them move forward, we'll look at the data, continue to examine it. The trend that we're seeing is really a positive trend. But I think that check with me, continue to check in with the information that you are provided in terms of that the decision-making that occurs. I think we'll have even clearer view a week from now as we move forward. And that's how I'm viewing it, and that's how I think that we will proceed moving forward.
Right. So I want to shift to vaccines and treatments. And Dr. Klebanski, starting with vaccines, and there's some questions in the chat about this as well. We have high vaccination rates in Massachusetts. Some pockets of resistance and even some questions about availability, although I think availability has been dealt with. But some have argued that, the drugs were rushed, they were experimental. How do you assess vaccine effectiveness? And when, do we get beyond, it's about a year now, when do we get beyond the idea that vaccines are untested?
Yeah, so we, again, we have the FDA, we have panels of experts that weigh in on how effective, safe vaccines are. And, when we started the pandemic, I would just say that the concept that there could actually be a vaccine was an unbelievable dream. I mean, I remember sitting around with groups of people saying, if only we could have a vaccine, it would be an incredible revolutionary moment. And in many ways, actually, that's true. I think what was not anticipated is the politics around vaccination, which we've talked about. But the fact of the matter is we do have the FDA. They do have the ability to give emergency authorization use for vaccines. And that has played out based on so much data that's come to the FDA. Now, even more recently, we've had full FDA approval for 2 of the vaccines. That's already happened. So even those people who would say, well, I know there's this special authorization, it's been used in millions of people, but it's not fully approved. I've heard a lot of that, but now it is. And yet we still have people saying, well, I don't know, maybe we should wait 3 years or 5 years. So I think the bottom line with all of this, Jim, is the data are just so overwhelming. Are there some people who get side effects? Yeah. I mean, but in any drug, you're going to have some people who have side effects. But a lot of this is fundamentally the politicizing of it. It's not understanding what the vaccines do. And, it's a lot of personal hesitancy. I would say from an education point of view, and I know we've all done this, we have gone to such great lengths to educate people, to educate patients, to educate our own employees on the importance of vaccination, the data behind it, what it all shows, what it means in terms of preventing hospitalizations. We've looked at a lot of the objections that have been raised based on lack of information. We've looked at ways to use trusted advisors within hospitals or within families or within communities. We've looked at a lot of the cultural and language barriers. So again, we've all done so much of this work, but you still do have pockets of people who fundamentally will not get vaccinated. And I would just say what we often hear is, it's my own personal choice. And I know we've all confronted the situation where, for example, with our own employees, we've said, yes, it is your own personal choice, but you cannot work in our healthcare system unless you are vaccinated, because we need to take care of patients and each other. So, that is where we are with this, despite, again, 2 of the vaccines are now fully approved.
I think it's really important that leaders like ourselves are clear and categorical, as Dr. Churchwell and Dr. Klebanski are on this point. These vaccines are absolutely safe and effective. And there is no other way to describe them. We know that based on the data. We know that based on the tens of millions of people that have now been vaccinated with the extraordinarily low complication rate, rivaling anything that we've ever used before. And we know how effective they are. And so it's really important that we be clear and categorical about this. These vaccines are the best thing that we have to fight this war.
Dr. Tabb, a follow-up from the audience. Given the high levels of vaccination rates in Massachusetts, was it a surprise that the spike in positivity rates during Omicron took place?
No, I don't think that it was a surprise. I think that we know, we've seen with viruses forever that viruses mutate and change. This virus will continue to do that, and we will continue to see peaks and valleys with this virus. So I don't think that it was a surprise. What was clear to us before and was true during the current wave is that if you were vaccinated, your chance of being hospitalized or getting severely ill or dying was very, very low. And so that was not a surprise either. And that held true. We knew that was going to be the case, and it turned out to be true. I think it will be true in the future.
Dr. Churchwell, turning to children again, the vaccines have recently started to become approved for children. The Pfizer vaccine authorized for children 5 years and older, no authorizations yet for 0 to 4. What's your experience in the public receptivity to their children receiving vaccines, and, again, are there hesitations?
Well, I think that the challenges that we've seen in the adult population, we are seeing in our population, in our pediatric population also. Does my child need the vaccine? Is the vaccine safe? Should I wait? Are the many times the driver of the questions and the issues. And those are reasonable questions to ask. And they have answers to them. And we continue to work to provide answers to those questions. It's the misinformation that sort of gets into the mix in terms of, is there a conspiracy, or if my child gets the vaccine, am I hurting my child? And Kevin's point and Ann's point is just so strong, in that the data truly shows that we're actually protecting our population, protecting our children by them getting vaccinated. It's not, vaccines don't prevent illness. Vaccine prevents you of getting significant critical illness that can cause significant morbidity and mortality. And that's one of the key components that we have to continue to stress. And that's why we've been so successful I believe, in this state in terms of our response to the surges that have occurred, because we've had such a high vaccination rate. And for our children, we are stressing the importance of vaccination for our children, and for our children actually protecting others in being vaccinated. And we'll get there. We'll continue to have that as our mantra in terms of what we say. And that the responses that we're getting have been positive, but it continues to be that communication that has to occur.
You know, Jim, the other important point to emphasize to everyone is vaccinations don't last forever. So one of the really important points to remember is boosters. So I've had many people actually say, I don't understand this. I've been vaccinated. Why do I need to get a booster? And I always remind people that the concept of boosters, we see that for many, many different things. Boosters are so common in pediatrics, in adult medicine. You get vaccinated for something, you need a booster. People get flu shots every year. A little bit of a different story there, but it's the same concept. One needs boosters. Yet here, there seems to be a great deal of reluctance across the country and in this state too on making sure people understand that vaccinations don't last forever, and to actually be fully immunized at some period of time, you should have a booster. So I think many of us have talked about what the definition of actually being vaccinated means. So within our own healthcare system, for people who are a distance out from their initial series of vaccination shots, they need to get a booster. So I really want to emphasize that to everyone, because what I don't want to see is patients, people who were once vaccinated and then become very sick in the future because they didn't get a booster.
Just a follow-up from the audience. Is there a second booster, third booster coming then?
So it depends on who you are. So for example, for the immunocompromised, there's already an acceptance of getting an additional booster. Kevin Tabb looked like he was going to say something, so I'll let him go ahead with that.
Well, I'd say that, none of us know for sure. And I think we're all following the science on this closely, and there isn't yet an absolute answer. But what we do know is that it would not be out of the ordinary. It would not be dissimilar from many other cases that we have seen, and described that exactly, for us to potentially need some sort of annual vaccination. We don't know the answer to the question yet, but it would not shock any of us, I suspect, if it were to turn out to be true, that on something like an annual basis, we would need to keep up our vaccines.
Jim, I know folks are looking for certainty in answers, but this continues to be an incredibly fluid environment that we work in, and it's fluid because the data continues to come in. Information continues to be present about how this virus works, what the consequences are of being infected, and what happens to our bodies in terms of our immune system from that standpoint. And all of those will continue to play itself out over the next few months in determining what is going to be necessary for protection. So I would continue to say, stay tuned as we get more information to determine what makes the most sense.
So, Dr. Klebanski, we have a question from the audience about the the pandemic of 1918, and you were educating me before we come on about some of that. But I think the question speaks to sort of what you were talking about earlier. I'll read it. Spanish flu from 1918 to 1922 eventually burned out and herd immunity was achieved. I don't know if you agree with that or not. Why is this virus now being portrayed as being with us forever, implying that that one's not? So have at it.
Yeah, I mean, we actually started this before the live session, talking a little bit about the history of viruses. So again, you know, the infectious disease experts always will go back to that 1918 flu and point out that that was a massive pandemic causing worldwide deaths. There were no vaccines then. There were no treatments then. It passed. And what happened? So again, you know, I would just go back to what I said earlier about the invisible war that's going on all the time in terms of mutations and variants. And you just don't know what's going to happen. So there are going to be some variants that are highly transmissible. That is, they are very, very contagious, but they're not going to cause much in terms of disease. And then you're going to get some viruses or variants that are not very transmissible. You can't catch it very easily, but they really do cause significant morbidity and mortality. So in some ways, I'll call it the war of the variants or the mutations to see which wins. So there's a lot of speculation that went on in 1918. You could say that there were mutations that no one knew about, and it burnt itself out, and that it wasn't very effective. There were differences that we don't know about. And then there is this concept of herd immunity. But I think for now, what we can say is this. We are dealing with a virus, and Dr. Churchwell emphasized this before, that is very deadly. And we're seeing lots of variants that have varying stages of how dangerous they are. But there's no variant that we've identified that we know about that's not dangerous. But they differ in how transmissible or in how contagious they are. So it really remains unknown as to where these mutants are going to go. So when people say, and I know we've all heard this, is it possible that this virus will just mutate itself out of existence? Anything's possible. But the fact of the matter is we just simply don't know. And the other thing, again, I would highlight is there are many families of viruses out there, which because we are such a really global community because of travel, because of so many things, it wouldn't be surprising if things that originate somewhere move very rapidly around the country and around the globe. So it remains to be seen.
Before I continue with the questions, I do want to note there were many, many positive expressions of gratitude in the chat and in the Q&A, and I'll just read one that I think capture them. I want to say thank you to all of you for your leadership during these difficult times. Words can't capture the amount of gratitude that the patient community has for you and your amazing teams. So a lot of those comments in the chat, so I thought I'd work that in before we ran out of time. It's a business audience, and we want to get back to work. So let's talk about getting back into offices and people's comfort or discomfort with that, along with gathering generally in life, weddings, parties, concerts, sporting events, all the things that make life fun. So getting back to work and getting back to fun gatherings. Dr. Tab, you want to start us off?
Yeah, I mean, I guess we seem to be repeating ourselves in stating that we don't know the exact time and exactly how this will unfold. But I think I feel confident in saying we're not going to see a sudden or definitive moment. It's not as if it's turned on and then will suddenly turn off. We're asked a lot about the definitions of when will this pandemic either burn out or become endemic, and what are the difference between those things? I think really what people are asking is not so much what is the definition of those things, but when can we get back to our normal lives? And I think it is already gradually happening, and more of it will happen, but it will come in waves. And there are things that will happen. We will open up, we'll start to gather in the coming weeks and months. based, by the way, on personal preferences and personal risk as much as anything else. And it may be that we'll have to retreat a little bit as things heat up again. And this constant assessment of risk and back and forth, I think, is going to be with us for a significant period of time. But it doesn't mean that we're all going to be locked up in our homes and never going out. I don't think any of us believe that that is what is needed.
Mm-hmm. I think it's true too, but Jim, remember too that we live in Massachusetts and it's very cold out right now. So one of the things we talk about in terms of viruses in general is the seasonality of it. So, you know, if it does get warmer again, there are more opportunities for people to gather outdoors. I don't want to emphasize that, but I don't want to ignore it either, because there is a seasonal component to viruses. We've been seeing this despite any season, but there is that worse in the winter when people are indoors phenomena. That is not true everywhere in the world, but is certainly true in this state and many others.
I want to shift a little bit to sort of the decision-making process. And you've all mentioned that during the pandemic in this state, Governor Baker has been very in touch with leaders in the medical community. And we know that tough decisions by yourselves, public health officials, elected leaders have had to be made. But, you know, those came with trade-offs. And there were some who suggested, you know, over time we haven't struck the right balance. That, you know, when you think about some of the things we've already talked about, think about the mental health impact, think about the hospital worker stress, deferred healthcare for other people, businesses closing, the vibrancy of the downtown, exacerbated divisions within politics, created tensions even in families, the exposure of racial inequities, students falling behind in learnings, stomping on individual rights. So you've got all of these other pandemic effects, I would say. But, you know, as Dr. Churchwell said, you know, people have died and are getting sick at the same time. How do you balance it? How do you talk about the decision filters in a circumstance like this between sort of the medical community, the public health community, elected officials to sort of get it right and, you know, deal with public frustrations around those other issues that I mentioned?
You know, I think in the best situations, there is constant communication and conversation between a variety of different constituencies around what's needed and what's important. I would push back on the idea that we went too far. I don't think, in fact, that's the case. Things change over time. It has been and remains a very severe illness for some people. I think there are times, personally, I don't think that wearing a mask, for instance, when the disease is highly prevalent, I don't think that that's an extraordinary lift. What possible reason could we have for not asking people to take simple precautions that we know work to protect our most vulnerable? And I think that we also need to acknowledge that we've got to focus not just on ourselves, but on caring for each other as a society. And at times of great risk, we need to take into account the safety of people around us and not just our own safety. You know, sometimes we tend to conflate small inconveniences with massive impositions. And I would encourage us to think bigger and understand the larger implications of our actions.
Dr. Churchwell, I look like you wanted to get in there.
No, I think that, you know, this is an event that happens every millennium. And with that, the issues that we have faced have been extraordinary. I think we've tried to keep and have kept the safety and the care and the health of everyone involved at the forefront of our decision making, and everything else falls under that. Mm-hmm. And with that, I think we've done an extraordinary job. What we faced has been a problems that we all didn't go to school for, I'll tell you that. And at some point, Ann's going to write the book, and I'm going to buy 10 copies of it.
Yeah, that's good.
But, in between that, it's still a learning. We're still learning and trying to keep what's important in front of us in terms of our decision making, and that's our people. And that's their health and their safety is what we've kept in front of us.
Yeah, I would just add, Jim, that there are things that we've learned along the way, and it is what's the greater good here. So when people say, I don't think that I will be affected by this virus, and then I will act in this way, that there's a broader family, community beyond to really think about, given the risks of the virus. And the other thing I'll say is shame on us if we don't learn some of the basic things that have been highlighted during this pandemic and how we approach, the future of care delivery and how we think about a lot of things. I mean, one of them, again, is how burdened we all were with finding capacity. And really understanding the importance of new care delivery models. What are we doing in our hospitals? What are we doing in community hospitals? What are we doing in ambulatory? What are we doing in the home? And what are we doing in virtual care? So this has just highlighted all of these things that we've been talking about, but without having some of those things there, I don't know how we would have gone through it, the scaling up of virtual visits and all of that. The second thing is, for all of the challenges in behavioral health, none of this was new. It's just exacerbated what has been a crisis in Massachusetts, in the country and beyond for many years. And the third thing that we all talk about is what has been highlighted in healthcare inequity. Again, we knew this. This is not new information, but it was exacerbated. So these are just some of the many things we need to get beyond. We see it and really learn and adapt because of it. And that's what we need to do going forward. So if wherever we are in 6 months or a year, we can't have forgotten what we've learned in so many ways as healthcare systems and as people.
Dr. Churchwell, could you just pick up on Dr. Klebanski's point about behavioral and mental health and what you're seeing in the hospital community emerge or come to the forefront, if you will, during COVID?
Jim, thank you. Thank you for that question. We describe what we've seen in behavioral and mental health in our children as truly our pandemic that has occurred over these last 2 years. And that the number of children that have presented to us with those types of issues of anxiety, stress, depression, etc., has just been overwhelming. The reasons why are still unclear, but of course they go to the stress around the pandemic, being in school, being out of school, social media, all of those have sort of been put in the milieu of our kids being exposed to this and their reaction to it. It's been a huge wake-up call. It's been a huge wake-up call in terms of the need for us to invest in the care of our kids with behavioral and mental health issues, from caregivers, from programs, from bricks and mortar. And what is it going to take moving forward for us to not to have Band-Aid solutions, but really create a continuum of care for our kids with these issues, because I think these issues are not going to go away. The exposure that our kids have in terms of these types of stressors will be different, but will be also there. And so our ability to understand, learn, and create solutions is extremely important moving forward.
So we're just about at time, and I want to thank you for your willingness to answer my sometimes provocative questions. I also want to express my personal gratitude, the gratitude of the business community, the people that have joined us today, and everyone for your leadership and the work of your teams during this pandemic. I do want to go around with one closing question that hopefully we can end on a note of optimism and ask you to look into your crystal ball over the next year a little bit and maybe sort of tell us what gives you reason for optimism and based on the data that you're seeing, can we be hopeful that we'll have a fun summer? Dr. Tab, you want to kick us off?
Well, what gives me the most reason for optimism is our people, because our people have risen to the occasion in ways that are just astounding. And I speak more broadly than our own staff. Caregivers certainly have. I think the community, the state of Massachusetts, people have risen and been resilient in ways that people might not have imagined we could be. We will get through this. We are already cresting on the other side of this wave. We don't know exactly what the future will hold, but we know already that we've learned a large number of lessons. And maybe the most important lesson in the healthcare community that we've learned is that we have learned to work together. Mm-hmm. And we have learned that when we do that, we can solve the most difficult issues that are in front of us. And I don't think that we will forget that one. So there will be more trials, but that really gives me a lot of hope.
Dr. Churchwell?
I think Kevin said it extremely well, that we continue to appreciate those that work in our environment because they bring the solutions to bear. And they continue to find solutions. They continue to find the answers to questions that 2 weeks ago we didn't even know the question. And so given that, we will get through this and we will be stronger at the end. Winston Churchill said, what's the best way when you're walking through hell? And it's always keep walking. And so we're going to keep walking and we're going to get this figured out and we will be the better for it.
Thank you. And close us out, Dr. Klebanski.
Well, you've already heard about people and resiliency and all of these incredibly positive things. So just the third thing maybe to add is we are in Massachusetts. We are a hub of technology, biotechnology, innovation, discovery, and for all of us and for many more healthcare systems around the state, our investments in science, what we have really devoted time and effort to, bringing in talented people, innovators, scientists to work across the entire Boston and Massachusetts ecosystem, that has reaped enormous benefits in understanding this disease, other diseases, how to treat them, and the development of vaccines. And I think for all of us in Massachusetts, in Boston, we ought to really take great pride in that, in addition to all the other fantastic points that have been made, because I agree with all of them.
Dr. Klebanski, Dr. Churchwell, Dr. Tab, thank you so much for giving us this time today and the benefit of your expertise and wisdom. And again, thank you to your institutions for what they do for us. We are indeed fortunate. And to our audience, thank you for joining us today. Apologies for the early technical difficulties. I hope it wasn't too much of an inconvenience, but this session will be rebroadcast or available on our website. So take a look at that and you'll see the whole program in its entirety. Thank you and have a great rest of the day. And I'm going to end it and say I'm optimistic that we're turning the corner and we're going to have a great 2022. Thank you.
Thanks, Jim. Thanks, everybody.
Thank you.
Thank you.